Hello and welcome to this podcast, Expert Voices in Clinical Aromatherapy. In this episode, we are with Denise Joswiak, registered nurse and director of the Alliance of International Aromatherapists, who shares insights about the ecosystem of aromatherapy in the United States of America. Denise describes how the National Center for Complementary and Integrative Health, named NCCIH, is organized. Her work contributes to integrating aromatherapy as a complementary approach in hospital settings. She is also part of the ARQAT, an organization which aims to improve the education of practitioners in clinical research. Enjoy listening!
In the United States, integrative health and medicine is growing. We have professional organizations such as the Academy of Integrative Health and Medicine and the American Holistic Nurses Association. Physicians, nurses, and other healthcare professionals who practice integrative health describe holistic care as person-centered care, including the body, mind, emotions, and spirit. Practitioners integrate many healing modalities into the allopathic medicine model. The National Center for Complementary and Integrative Health is part of our National Institute of Health and is a repository for the information and research around complementary and integrative health. The center has worked to advance the position that evidence-based complementary therapies should be integrated with and not used as an alternative to conventional medicine. The NCCIH's new strategic plan for 2021 to 2025 expands the definition of integrative health to include whole person health. That is, empowering individuals, families, communities, and populations to improve their health in multiple interconnected domains: biological, behavioral, social, and environmental. One of the National Center for Complementary and Integrative Health's objectives is to advance research on the whole person and on the integration of complementary and conventional care. Another objective is to focus on health promotion and restoration, resilience, disease prevention, and symptom management. The mission of the NCCIH is to determine, through rigorous scientific investigation, the fundamental science, usefulness, and safety of complementary and integrative health approaches and their roles in improving health and healthcare. This model of healthcare has evolved greatly over the past several decades. Aromatherapy is definitely part of this global integrative health evolution. Many U.S. hospitals, healthcare systems, long-term care facilities, palliative care, and hospice services have implemented aromatherapy programs. My current experience is as an educator, offering an aromatherapy certification program which prepares healthcare providers to create their own aromatherapy program or offer aromatherapy to patients as an integrative practitioner. I am also a consultant helping facilities who do not have a certified aromatherapist on staff to create safe, effective programs that meet the needs of their patient or client population. Programs range from staff-delivered aromatherapy available to all patients in a healthcare facility to practitioners working one-on-one with patients, allowing specific formulations for each individual's specific needs, to programs supporting healthcare staff. My favorite example of a program is the Allina Health Aromatherapy Program. I was part of the staff at one of the hospitals when two of us, both nurses and certified clinical aromatherapists, were asked to create the program, starting with 10 hospitals. We chose 4 essential oils to keep it simple: lavender, sweet marjoram, mandarin, and ginger, focusing on improving 4 patient outcomes: pain, nausea, anxiety, and sleep. We created a 1-hour online aromatherapy training, and 3,357 nurses took that training in those 10 hospitals. The program began in 2012. In 2014, we looked at 2 years of retrospective data. The modes of administration we used were 78% inhalation, 19% topically, and the remaining was a combination of the two. A total of 10,372 nurse-delivered aromatherapy sessions were reviewed. The software we used took into account whether patients had medication or integrative therapies, and then subtracted the average decrease those therapies would have resulted in from the aromatherapy results. So the data suggested the change resulting from the essential oil itself. The data showed that patients perceived their pain decreased by 3.31 points on a 0 to 10 scale, anxiety decreased by 47%, and nausea by 50%. Our research suggests that patients who receive aromatherapy along with standard medical care report, on average, statistically significant decreases in pain, anxiety, and nausea. We presented 3 posters and published in Complementary Therapies in Medicine and the Journal of Nursing Administration. Our next step was expanding the aromatherapy program to include additional outcomes requested by the nursing staff. For example, tobacco cessation, because smoking wasn't allowed in the facilities and it was difficult for our patients. I believe evaluating aromatherapy interventions is a mandatory component of every aromatherapy intervention, and conducting clinical research is incredibly valuable. The field of integrative health science requires quality publications for our practitioners to provide evidence-informed care. I am part of the executive committee on the Aromatic Research Quality Appraisal Task Force, also known as ARQAT. We created a checklist for aromatic research consumers and plan to publish that in an open access journal. We are collaborating with the Gattefossé Foundation, and once we publish, the checklist will be available on the Foundation website as well as on our ARQAT website. After collecting a consensus of expert-based judgments through a Delphi process, we will create a reporting guideline as an extension tool for researchers. In addition to research, practitioners have access to other forms of support. As the current president of the Alliance of International Aromatherapy, or AIA, I feel professional organizations play a very important role. We have robust committees focused on clinical aromatherapy. We offer monthly webinars, regional meetings, and conferences featuring speakers from around the globe, and publish a quarterly journal, all with many stories containing information about essential oil use with patients and clients. We've created outlines for classes and workshops and clinical aromatherapy guidelines for those wishing to create a hospital program. We have a research database and support all levels of membership, from students to advanced practitioners. I encourage all aromatherapists to continue learning and seek out resources to be the very best they can for their patients and clients. The Gattefossé Foundation is uniquely positioned to support aromatherapy in the clinical setting. I am honored to be part of the Gattefossé Foundation International Jury. Part of the Foundation's mission is to support the practice of aromatherapy in health facilities. Their desire to do this on a global scale is evident in their decision to offer the René Maurice Gattefossé International Prize. The previous award winners are featured on the Foundation website, and their stories are inspirational. If you have an aromatherapy program, please consider applying for that next award. You can showcase your program, which will benefit the aromatherapy community. You also can consider how the prize will improve your program and ultimately help you support your patients' well-being, because that's what clinical aromatherapy and integrative health is really all about.
This was a podcast produced by the Gattefossé Foundation for Clinical Aromatherapy. In the next episode, Jackie Stringer will share her experience of bringing aromatherapy into clinical practice in oncology. To learn more and discover the projects of the Gattefossé Foundation, please visit our website. Thank you for listening, and come back soon!